Good morning, everybody, and welcome. My name is Tamsin Rose, and I have the great pleasure of being your moderator this morning for the webinar on the importance of biosimilars for patients with colorectal cancer in Europe. And we're going to be looking at the European policies in the way that they address biosimilar use in cancer. I'm just going to give people a few more seconds to join because it takes time for people to be adding in. But we will be running this morning until 12 o'clock. This event is being recorded for our internal communication purposes and so that we can produce a good quality report that will be shared with you afterwards and you can use it. We encourage you to engage with us, and you can see at the bottom of your screen there's Q&A and chat functions. Please feel free to use those to engage with us. Questions for the panelists and speakers, please put them in the Q&A. If you've got a technical question or something else, please put it in the chat. We'll be monitoring that, and at various points, I'll be bringing you, the audience, in to help us discuss these issues. We're delighted that you've decided to join us on this important topic, and we count on your interest and support as we take this issue forward. I have encouraged all of our speakers to speak slowly and clearly because we might have some quite technical issues that we're going to talk about, and I appreciate that English may not be everyone's first language. So I ask, if you have a problem or if you need clarification, or even if you need people to slow down, please put that in the chat so we can respond and make sure that you have appreciated and understood everything we're saying. I'd like now to introduce our first speaker, who's going to give us the context, because we want to understand why are biosimilars an issue and what do they mean for patients? What's the patient perspective, and why should we all care about something called biosimilars? Barbara, let me introduce you, and I'm delighted that you're able to join us today to share your story and explain to us what impact biosimilars could have on the quality of life and life of patients with cancer across Europe. Barbara, the floor is yours.
Good morning, and thank you so much, Tamsin. I'm Barbara. I'd like to tell you a bit about my cancer journey and how actually this is linked to biosimilars, raising awareness of the importance of them. Not only for patients, but also for clinicians and healthcare practitioners. I was diagnosed with stage 4 colorectal cancer with a primary in the ascending colon and a 15-centimeter tumor in my left liver, and I had recurrence in the lymph. However, the great news is that having been given a prognosis of only 3 months and no hope, I'm here and cancer-free for 13 years. Thank you so much for the privilege in talking to you. I'm often seen campaigning, speaking about access to drugs, licensing of drugs, correct diagnosis, personalized treatment, and recently, cancer patients' care during COVID. There is a reason I campaign. Patients experience the real shortfalls in healthcare. We know how good or how difficult it can be. I knew nothing about cancer when I was first diagnosed, but I think that my increased knowledge over time, assertiveness, and fight for a certain treatment gave me a positivity and awareness that helped me to survive. And a certain drug that shrank that large tumor in my liver sufficiently so that it became resectable. I'd like to tell you a little about how my family and I turned around this situation of no hope to the full life that I have 15 years on. I was a teacher and 52 years old when I was diagnosed with stage 4 because I was anemic. I was told my treatment could only be palliative. There was nothing they could do. I needed an immediate blood transfusion and a CT scan a few days later. No hope is final. However, certain people remain in my memory as people who helped me to jump hurdles. The liver surgeon said he was prepared to operate on me if that tumour in my liver shrank away from the portal vein, the only vein that had to remain intact. So why did this make such a difference for me? And how is this related to biosimilars? Because I knew so little, I was very much at the mercy of my doctors. I accepted everything I was told, and I didn't question anything. But now I had a plan. I got through the normal hiccups of emergency hospital visits, allergic reactions to chemo, side effects of chemo, and so on. I tried both types of chemo, and with different add-ons, things weren't looking good for me. Mark, my husband, and I read about biological treatments being used in Europe and America, and we asked about them. I was told they were not available on the NHS. This was the start to my drive. From a position where I totally accepted my fate, I now had an inquiring mind. After all, it was my life, my future, my family, and I felt that I should be aware of the choices and making the decisions on what happened to me. Mark and I had entered a new life that very much put us in control of what was about to happen. And we greatly involved the media for the following years. I was refused that biological treatment that we'd asked about. So we appealed, but in the end, we paid for it. It cost £21,000 for just 4 treatments. In 2007 in the UK, you lost all your entitlement to the free NHS treatment if you just added one private drug to your existing regime. You may be interested that I took my story to the press and it was taken to Parliament, and it actually helped to change the law so that you can now purchase a private drug without losing that NHS entitlement. I was lucky. The drug worked dramatically and my surgeon could operate, but he told me it was a 50-50 chance for me that I would not survive the op. It was my decision and I was prepared to take that risk. Quality of life over overall survival is a decision patients often must make. I was so happy to be offered this. I really felt lucky. Patients have a right to this choice. 14 years on from 2007, there is so much more known about cancer. There is no one size fits all. There are so many different types of treatment for cancer, biologicals holding great importance, and diagnostic testing to make that treatment personal. Although there's a long way yet to go, we have come a long way from when I was ill. One thing is certain though, there are patients who are still not being offered the best known treatment for their illness, and many are not being given a choice. My story reflects this, because firstly, I was not offered the choice of treatment. Even when I researched and asked about it, I was refused it. And this was the treatment that enabled resection that saved my life, which is why I'm here today. The reason for refusal by the NHS was not safety, but cost. I am alive, amongst other things, because my family paid for that treatment. I feel guilty because I've survived while others were not given this chance. I have campaigned for equal access to drugs for all ever since. The use of biosimilars lowers the cost of the comparable treatments, making drugs available, making them accessible to more patients. From all the information available today, I would feel confident to choose such a treatment for myself today, because it is comparable in every way, safety and efficacy through rigorous testing. They go through the same approvals procedure with the EMA. I strongly feel that the strength of patient stories like mine were successful in highlighting the difficulty in accessing expensive drugs, biological drugs. Today's patients often believe, because they've heard about those drugs, they believe that this is what they need. Biosimilars that perform in the same way do not have these success stories behind them as yet, and so they stand at a disadvantage. This is a natural response for any newly diagnosed cancer patient clutching at limited information. We know that 2 batches of any biological drug cannot be the same, and so the comparator will also not be exactly the same. And although there is still a lack of biomarker testing for some treatments, we do have greater knowledge in choosing the right treatment for the right patient for colorectal cancer patients. As a campaigner for equal access to new treatments, I really see it as our duty to make facts known to our patients and professionals, thus unlocking treatment options. It doesn't make sense to choose a more expensive treatment option, depriving access to best treatments for so many more patients. The addition of a biological drug is the reason that I'm alive. My life has made a difference, firstly, of course, to my immediate family, but also to so many more other patients through advocacy. Surely, we should now seize the opportunity of widespread use of biological biosimilars, dramatically reducing cost and helping to deliver the advocates' call for equal access to drugs. Thank you so much.
Thank you, Barbara, for sharing your story and also explaining very carefully the different processes and how you transformed your experience and your struggle, not only in a campaign for yourself, but the impact that had for others. And thank you again for staying in the fight. 13 years later, I'm delighted not only that you're still here, but you are continuing to advocate, continue to explain and make the situation very clear to people. And you've again made the case that, you know, there's some concerns obviously about trust in biologics, but the point there is no 2 biologics are the same. So there are ways of addressing, there are ways of managing this within the healthcare system. So it's a really wonderful, inspirational way to start our webinar. And I thank you very much, Barbara. And I noticed that we've had some comments in the chat again to say, thank you, you were clear, you were careful, and people now have a real understanding of the difference that this kind of policy could make. And that's the best way that we could have started our session. So thank you very much to you, Barbara. We're now going to move on to the next element, because Barbara's explained just what a difference this could make to individuals and, you know, the potential benefits to individuals, to health systems and others. So now let's hear from Professor Fernando de Mora, who's a professor of pharmacology, therapeutics and toxicology from Spain. And he's going to tell us a little bit more about what's stopping us from using biologicals more widely. What are the barriers towards uptake of biosimilars? Professor de Mora, you're very welcome. Please, the floor is yours.
Thank you very much, Tamsin. Thank you for putting all this together. And obviously, the whole team of Digestive Cancers Europe has done an excellent work. I have to congratulate. But allow me, please, to particularly acknowledge Vasiliki Fotaki's exchange with me, because I've had a lot of exchanges with her, and she's approached it in a very humane and efficient way as well. So thank you very much. This is an important event. I think we'll have to thank as well the member of the parliament that will join us. They need to be sensible to those issues, and that's a good move from your side. And let me take it from there. And Barbara, you've done a very good, nice job at telling your story very candidly. Your testimony is useful. Don't feel guilty. It is very useful for other people. So that was extremely important. And I think I take 2 things from your testimony. One is biologics are a must. They are needed in cancer therapy. They save lives. They saved your life, and that's extremely important. But the other thing is that we need to have access to them. We need to have access to biologic therapies. And biosimilars do help to do so. Biosimilars are important. So I have been asked to talk about the barriers to the entry of biosimilars into the national level. And certainly there are barriers, but I rather change a little bit the title, as you see here, and rather try to think about national actions in 8-9 minutes that may increase biosimilars uptake. And I'm sure that I'll overlap with other people's presentations, but I will try to concentrate on that. So please go to the next slide. If I had to summarize the main barriers to biosimilars uptake, I think I would divide it into two things: a lack of knowledge and a lack of records of biosimilars' health outcomes. And the other thing is, the other missing piece of the puzzle would be the need for policies, the need for guidance, and maybe the need for legal actions at the national level. So those are the two things that I think governments in Europe and elsewhere could try to foster to make sure that biosimilars uptake increases. Next, please. So I said I would try to flip the coin, see it in a positive way, try to think about actual national actions. Now, if we take those two barriers, knowledge and records, certainly we'll all agree in this session proves so that education is a must. If you know biosimilars, you have more confidence in biosimilars and you use biosimilars. But I will not stop in education. I'd rather focus on the need for governments to foster the creation of patient registries, big data management, data about the health outcome, of the therapeutic outcome of the use of biologics. That's a very important move that needs to be fostered by governments. The other thing is, as for policies and guidance, I would say that we need, or governments need, to put in place policies at two levels. Trying to provide recommendations regarding interchangeability, and also incentivize, motivate the use of biosimilars, motivate biosimilars prescription. Governments have a big role, healthcare authorities have a big role in fostering those two things. So I'll try to briefly explain each one of those two missing pieces in some European states. Next, please. Incentives. Governments need to incentivize the use of biosimilars, to put in place measures to do so. And one such measures may be the gain-sharing agreements, which means that by using biosimilars, you are able to accumulate funds, financial resources that may be reinvested or redistributed towards hospital or medical departments. And that's a very important move. Prescribers will be incentivized to use biosimilars if they feel that there's a reversion towards their own daily practice. And ultimately, who gains is certainly the patient.
Because it links.
We maximize the benefit for the patient. So incentivizing biosimilar use is a very important measure to be put in place by healthcare authorities. Next, please. Interchangeability policy. We need to support prescribers on interchangeability. See, some people think that by regulating something, you put limits to it. And what you do by regulating or by providing guidance is to foster the use of something. Providing guidance on interchangeability, providing guidance or providing education on What does interchangeability mean? Establishing policies on interchangeability will support prescribers on practicing the switch from one product to another. And that certainly will also contribute to maximize the benefit for the patients, to create funds that may be then delivered to other healthcare aspects or issues. So interchangeability policies are necessary at the national level. Next, please. I mentioned about patient registries, and this is extremely important. If you increase the use of biologics by utilizing biosimilars, by prescribing biosimilars, there will be more data regarding the therapeutic behavior, the clinical outcome of a specific therapy. And this may change the therapeutic paradigm. You know, if we have more patients treated, we may realize that patients with a moderate disease may benefit from these treatments, or we may realize that other targeted patients may benefit, for instance, children, or we may optimize such a treatment. So we need registries, we need an exchange of information to make sure that the increase of the use of specific biological product may uncover new therapeutic paradigms. And that is extremely important, and governments need to fund those registries or contribute to fund those registries. Next, please. So what is in for the patient? I mean, why are we talking about biosimilars? Why would it be interesting for the governments to increase uptake? We have talked, and I'm sure other people will talk in this particular webinar, about the collective gain by using biosimilars. Healthcare sustainability, avoid or prevent shortages. This is very important. Foster, and this is also very important, innovation. So there's a social gain, there's a collective gain for patients, but there's also a given patient gain, if I may. Next, please. It's not only about a collective gain, it is about your own gain. You will have access to biologic therapy if there are biosimilars in your market. You will have probably an earlier access to biologic therapy. Not only access, but you may be able to access that biologic therapy early in the course of your disease. You, by having biosimilars in your market, you will ensure that you will not have to stop your treatment because of shortages. If biosimilars do coexist with originators, chances of shortages are lower, and therefore you can keep on with your treatment. You may have access to new therapy if you need it. If your therapeutic approach fails, if you have adverse events to a particular biologic, you may have access, thanks to the presence of biosimilars, to new therapies, to innovative treatments as well. And you have access to innovation in the biosimilar itself. Immediate innovation, like, for instance, an easier to use delivery device. So biosimilars have consequences on patients, benefit patients essentially. Next and last image. So we need to put those pieces of the puzzles. Governments, national healthcare authorities need to put that piece of creating registries, creating interchangeability policies, and creating incentives to the use of biosimilars, because this will maximize the value that biosimilars bring to healthcare systems and ultimately to patients. Thank you very much.
Thank you very much, Professor De Mora. I mean, you've really, I think, taken us through the process and explained why we have some challenges and how, if we use biosimilars more, we'll create more data, we'll understand more about them, more patients may benefit from them, but also you've identified what we need to put in place systematically for us to be able to both use biologicals and biosimilars more effectively and then generate the data to understand it. And I think also you've highlighted the individual gain and the collective gain, and there's win-wins on both sides, but we can't generate those wins until we actually use them and have the structures in place. So that was extremely helpful. You're going to be joining our panel a little bit later, and the audience will have an opportunity to ask you some questions. So thank you, Professor Moore. We're now going to move to the next presentation, and we have a video presentation from Professor Zoltan Calo, and he's going to give us an overview about how biosimilars are linked to the overall sustainability of our healthcare systems, which of course, post-COVID is going to be a key concern for policymakers. So let's watch what he has to say.
Dear colleagues, I'm really sorry that I cannot be here with you today due to a conflicting commitment. My name is Zoltan Calo. I'm a professor of health economics, and in this presentation I will provide an overview on what can be the benefits of biosimilar medicines in different countries. A few years ago, we published a paper about what can be the policy objective of patent medicines. And you can consider this from the disinvestment perspective, where actually off-patent medicines can reduce health expenditure without compromising health outcomes. So they can contribute to the sustainability of healthcare financing. But you can also look at it from the investment perspective. In countries where there is limited patient access to new medicines, after patent expiry of patent medicines can increase the population health gain by improving patient access without actually the need for extra budget. So the major benefit of patent medicines in these countries is improvement of the health status of the population. When we consider limitations in patient access, you can see that there is a difference between higher income and lower income countries. Actually, this paper was published about European Union member states, and what can be observed that although post-launch, the lower income countries delay the drug listing, the reimbursement of new medicines, and that's what many people know that why patient access is more limited after post-launch. But the real difference is coming several years after launch, when medicines are already reimbursed. But in lower income countries, the sustainability of healthcare financing is usually maintained by hidden patient access barriers, and as a consequence, the utilization of biological medicines is much lower in lower income countries than in middle or higher income countries. So this specific case is about colorectal cancer drugs. And if you consider any other disease areas, the picture is always the same. It is also important to understand that there is a similar difference, and here the differentiation is not based on economic status, but based on geography. So you can see Eastern European, Western European countries, which in fact very much correlates with economic status. So Eastern European countries are poorer than Western European countries. And if a patient is diagnosed with colon cancer, the 5-year survival is significantly lower in Eastern European countries than in Western European countries. And the difference can be up to 15%. So there is a considerable difference in the unmet medical need. Eastern European patients have more potential to improve the health status than Western European patients. The previous slide explained the survival differences in colon cancer, and this figure just replicates the same data in rectal cancer, and the difference is astonishing. Patients in Eastern Europe has much lower chance to survive the next 5 years after diagnosis with rectal cancer. So the previous figures explain to us that the patient access to biological medicines in colorectal cancer is much more limited in lower income countries, and the unmet medical need is higher. There are more lives to be saved, which means that after patent expiry, biosimilar medicines should have a different objective in lower income European member states. Instead of biosimilar medicines, the cost saving potential of biosimilar medicines, we should highlight the fact that after patent expiry, the hidden access barriers can be removed, and the increased patient access can generate significant health gain to these patients. And by doing that, we can reduce the health gap between higher and lower income European member states. This summary slide explains that what can be the value proposition of biosimilar medicines in different countries. So in those countries, mainly high-income countries, where the originator medicine is original biological drug is reimbursed without any access limits, the value proposition is savings in the drug budget. So the decision context is a disinvestment perspective. In those countries where the originator biological drug is reimbursed, but reimbursed with access barriers, access limits, volume limits to patients, if every patient uses biosimilar medicines, the decision context is reinvestment of savings to treating more patients. And the value proposition is health gain by increasing patient access without the need for extra budget. And in the very poor countries where even the originator was not on the reimbursement list, certainly after patent expiry, there is an opportunity to reimburse the biological medicine, the biosimilar medicines. And so the major benefit is health gain with relatively minor increase in the drug budget. So what can we learn from this short presentation? The most important message is that one size fits all doesn't work in terms of biosimilar policies. They should be targeted to each country according to the accessibility of patients to biological drugs before patent expiry. In lower income countries, policymakers and healthcare payers are the key stakeholders. In a top-down approach, they should change therapeutic guidelines. For treatment-naive patients in financing protocols and guidelines, biosimilars should be the first-line therapy, even before other patented original biologicals. And for maintenance patients, switch from original biologicals to biosimilars under medical supervision should be mandated or at least incentivized. Thank you very much for your attention.
Thank you very much to that video input from Dr. Callow, and we really appreciate that he found a way to be with us and contribute even if he couldn't physically join us at the time. And of course, his PowerPoint and the details will be part of the materials that will be released, so you'll have a chance to use some of that content. I'm delighted to introduce our next speaker, Dr. Rosa Giuliani, who's going to explore with us, what are the incentives from the point of view of the healthcare professional to using biosimilars. If you look at the journey that we've had, Barbara set us off by explaining very clearly why this matters for patients, the difference it makes. Then we heard a little bit about some of the challenges, the lack of knowledge, the concerns about how it would be done. And we just had a very clear message from Dr. Callow about how there are inequities across Europe and how the use of biosimilars could be a game changer for some patients. So now the next piece of the puzzle is, how do we change the behavior of healthcare professionals so we do get more use of that? And that's over to you, Dr. Giuliani. What can you share with us? How do we get this into the practice of our healthcare professionals?
Hi, Tamsin. Thank you for the very nice introduction and summary that you made. First of all, I'm really delighted to be today here with you. And actually, listening to each presentation, I thought, wow, because, you know, I'm in agreement basically with what has been said so far. Everything has been said makes sense. And this is something that is not so common to find, you know, in discussion, where sometimes there are major barriers in terms of disagreement, different positions. So it means that what we are discussing, so the you know, uptake of drugs that actually can change the natural history of disease, is really a very important topic, and we can see the potential of it. I mean, it's not only the potential, because now it's a few years that we are discussing about it, but we really need to try to let's say, maximize our commonalities and common views. So as an healthcare professional, and as an healthcare professional living in Liverpool, from where this picture was taken, you know, music is everywhere, and the Fab Four is everywhere. So I think that whenever, you know, there is an approach to discussion about new intervention, I think that those four main pillars are really playing a major role in the way I, again, as an healthcare professional, as a medical oncologist, understand things and formulate my choice and direct my choice. So I'm happy that previous speakers have already highlighted very important concept, which are the provision of value-based oncology care, which is essential in our system today in each part of the world. And for me, it's very important, each one of these pillars. So science and the amount of science that we collected so far about biosimilars is undisputable. There is a clear evidence, there is a clear science backing this drug. And despite the fact that unfortunately the recent pandemic has proven us as you know, the mankind can challenge science even when there is evidence, I think that this is a very basic concept that we need to start from. So there is a solid science behind the development of these drugs. There is a regulatory expertise to assess properly these drugs. We heard this before. There is also a clear position from the, what I say, the oncology community, where the oncology community is represented not only from, of course, from healthcare professionals, but from patient advocates, patients, and everybody else has a role in promoting access to beneficial intervention. And it's very important that when thinking of access to whatever innovation more in general, which is a cancer drug, which is devices, which is pathways of care more in general, we really need to think of in a way that we are offering the best option to patient, but at the same time supporting and sustaining the healthcare system. So my first, let's say, the first incentive, the first positive message in my side, on my side as a healthcare professional is that it is clear, has been already mentioned, that there is a very different access to important cancer drugs, biologicals, that actually have changed the natural history of disease. This is happening everywhere, and even where in countries where that we consider high-income countries, where we perceive that this problem maybe can be slightly less prominent than in other cancers, we need to remind that in some of the high-income countries, there are a sort of hidden costs, which actually are out-of-pocket costs for patients that are not properly reflected when we have this type of discussion. So there are many patients that actually do not have access to transformative drugs, cancer drugs, and I think this is really unfair. As an oncologist, it is really important to provide this option to cancer, both on a, let's say, on a personal practice level, and as a sense of of a community. So I'm thinking of my society, the European Society for Medical Oncology, for which one of the main pillars of the vision of the society is to provide accessible and sustainable cancer care. And so for me, the major incentive is, of course, to increase access. And I think that biosimilars fit very well in increasing access and into the innovation concept. Now, the other important point when I was thinking of science is that sometimes we have discussion, and maybe we will have the opportunity to reflect more and to discuss more this point about, interchangeability, switching, and so on. And I think that this is a problem that can be solved once again by filling the gap in the lack of knowledge, and also defining clear policy to be proactive towards this point. So basically, as medical oncologist, in a way, I'm prescribing, even if I want to use the originator drugs. We know that the originators went through several manufacture changes. Some of them are really key changes. They are strictly monitored by the agency, the regulatory agency that have expertise in doing so. And basically, as a medical oncologist, I cannot see the struggle in switching or interchangeability when I know that I'm prescribing, even if I prescribe the originator that I'm using in 2021 is a sort, if you want, of modified molecule, and so biosimilar, if you want, of the originator that was produced 10 years ago or 20 years ago. So I really do not get this point and this fear about switching and interchangeability. One of the pillars that I told you before, it's, again, as a medical oncologist, I want to be supported. I want to have the sense of community. I want, maybe I may not be necessarily an expert in understanding all the details from, from a given drug or a class of drug, a new beautiful concept of innovation, such as the one provided by the biosimilar concept. So it's very important that the society, they play their role, that the learned society, groups, patients are absolutely key. I mean, the powerful and beautiful experience that Barbara shared so as in a way so simple, so clean, I think has reached out very beautifully all of us. So knowing that there is this kind of supportive and positive position from all the oncology community, it is very important on my side, not to quote, for instance, the position papers of the society and so on, including the excellent work that is being promoted, including position paper by DICE. And then, of course, for a practicing oncologist, it's really important to have these incorporated in guidelines, because I know that, again, that I'm doing the right thing, because there are, groups maybe or more experienced colleagues of experts that actually, again, review the data and advise very clearly the use of biosimilar. This is just an example from a guidelines for breast cancer, for metastatic breast cancer, where there is clearly conveyed the message about the use of biosimilars. Other major organizations, such as the WHO organization, World Health Organization, have done similar work. So I think that, this is a puzzle that really can help me as a healthcare professional to have the right idea and to have the confidence to prescribe this drug. Now, the question is that I have is, well, if everybody, in this forum, in this meeting, I think that there is a general alignment. I think that we are discussing something that is really straightforward, it's really evident. So we need to really understand where the disalignment is. As I say, I think that there are, maybe I can see again as a practitioner 3 major points. So there is always a need to sometimes to fill a gap about education, because there are new generation of colleagues, because there are colleagues that need to be reminded, and rightly so, about very key data. So there is this work in terms of generating education that should be like an ongoing work. In terms of financial incentives, this is another point. Again, as a practitioner, I would like to know about the reallocation of resources. So and have the sense that what we are doing is going to be, reflected in a positive way in the increased access that I mentioned before. And then, of course, I wouldn't mind, again, as healthcare professional, to be helped in my daily activity and to reduce any type of administrative burdens, bureaucratic burden that should be relieved by my practice, so that everything. I mean, the question of using this drug is really simple. So there is no way to make it more difficult and to add weight to maybe to very busy clinics and so on. So I'm happy for this concept to be incorporated in clinics. And I would like to stop here for the time, and then maybe to discuss further in our panel discussion later on. Thank you.
Thank you very much, Dr. Giuliani. Very interesting. And I love this nice final slide looking at the three key issues about, we need to educate new cohorts of healthcare professionals. We need to be clear about the financial incentives to switch and to see where the savings might go, so healthcare professionals could see how that would give them the capacity to treat more patients. And we need to make sure they don't have to have additional layers of paperwork in order to be able to do it. So I think this is really helpful. Let me now introduce our next speaker, and that's Yannick van der Plas. And we're going to explore a little bit more about this issue, about how we engage with people and how we encourage people to do it. So my first question to you, Yannick, is why is it important to inform patients and healthcare providers about biosimilars?
Yes, thank you very much, Tamsin, for the introduction and for the question. I would first like to thank everyone of DICE for having me here, and also for the interesting presentation that I saw already. So coming to your first question, why it is important to inform patients and healthcare professionals in general, I think for the patient story, two main aspects play a role. We know that when patients are being correctly informed about biosimilars, they accept biosimilars to a larger extent, especially in the context of switching or transitioning from their originator products towards a biosimilar. It is important when they are being informed in a correct way with the adequate and the right amount of information that they will accept the treatment with a biosimilar more. This is something that we know from earlier clinical research. Second, and this is something that comes along, of course, with the higher acceptance, is that if you build trust among the patient community about biosimilars, that they will also have better clinical outcomes, especially in the context of nocebo effects. So nocebo effects meaning that patients who will have, let's say, less trust in their medicine or in their biosimilar in this case, is that they will encounter more subjective symptoms, for example, according to their treatments with the biosimilar itself. So if they are being informed correctly, not only will they accept biosimilars more, they will also encounter better clinical outcomes.
Great, that makes sense, particularly focusing on patients. But now let me ask you, Yannick, how does the approach differ between patients and healthcare professionals when we're informing or communicating about biosimilars? What do we need to say differently to the healthcare professionals?
Mm-hmm. Yes, I think that's a very relevant and on the other hand side also a very difficult question. I think the approach for educating or informing healthcare professionals and for patients should be different, and it's from a completely different nature, in fact. Of course, on the one hand side, we have the healthcare professional who is, let's say, confronted with biosimilars on possibly a daily basis or just in a professional context as a pharmacist, as a nurse, or as a physician. These are the people who deliver those medicines and also prescribe those medicines. So they have to be informed professionally. They will have to know all the different details, the ins and the outs from a more scientific point of view and also the regulatory point of view about biosimilars. Second, we have patients. Patients, on the other hand side, are not always in contact with biosimilars first. And I think it's important to mention that the biosimilar debate will only become when they are confronted with indeed those choices of medicines. For example, one of the main areas where biosimilars are being prescribed are in the field of rheumatoid arthritis, for example. Not all patients with rheumatoid arthritis will require information or will encounter the option to be treated with biosimilars. So it's important. I would say the main difference is targeted, tailored information. For patients, it's important to tailor your information to those patients who need the information. For healthcare professionals, they have the duty to be informed themselves. And on the other hand side, of course, let's say the level of such language, or let's say, I would say the information have to be more understandable for patients, tailored to their knowledge, and that's different in terms of compared to healthcare professionals.
Okay, thank you. So, healthcare professionals, it's broader, they all need to know about it, but the specific patients who need to know then need tailored information based on their own specific circumstance, their understanding, their knowledge, their level of engagement, etc. So you've got a very tailored approach for patients and a broader approach to healthcare professionals. Okay, so now let's explore a bit more in detail, what are the strategies that you could use when you inform patients about biosimilars? Because Barbara explained, the moment at which, there's a possibility that you get told you've got a very serious disease, possibly in a very serious situation, because it's often for metastatic cancer. And then suddenly there's another option. So what are the strategies we use to inform patients so they have trust and feel confident and feel engaged in decision making?
Yes, thank you for this question again. I think there are, of course, a lot of strategies that could be researched further into in the coming years. But we, in fact, from our research side, we identified 5 main ways how to communicate, or 5 main points of attention when communicating with patients. So first of all, as already being touched upon in the previous question, it's important to have up-to-date and understandable information for patients. They do not have the same level of, say, understanding of medicine in general, so it will have to be tailored towards their specific knowledge. It's important to have, and this is one of the main things, I guess, especially for healthcare professionals when they communicate with their patients, it's to communicate positively about biosimilars, not only emphasizing the possible side effects or possible differences that might be relevant, but it's important to emphasize the similarities, to talk about it in a positive way. Biosimilars are equal treatment alternatives in comparison to the reference biological product. It's important to emphasize this aspect. Also, when communicating positively, I also mean that it should be an open attitude, a positive way how to talk about biosimilars. This is something that we know that helps to build trust among patients about biosimilars. And very much in line with this, it's also one of the main things that should be done when talking about biosimilars, that every single stakeholder, whether it is a healthcare professional or whether it is a regulatory agency, it is a government or a patient organization, everyone should talk about biosimilars in the same way, having not only providing the same amount of information, but also talking about it in a positive way. This is simply to avoid confusion. And as we know, avoiding confusion is one of the main things, one of the main points of attention when informing patients. As already said, it's important to tailor the information towards the individual needs of each patient. I think many of you will know that from a healthcare provider's point of view, not every patient will have the same amount of questions or the same amount of doubt regarding biosimilars. Some will just agree with the physician prescribing the biosimilar and switching or initiating the biosimilar. Others will have a lot of questions or will have certain doubts or other, let's say, questions. So it's important to know which kind of patients need what kind of information. And lastly, and I think that many organizations already do this to a larger extent, and it's becoming more and more popular, let's say, in the scientific community as well, to use supportive material. When patients come to the physician's office, it's important also to give them other, or to refer them to other sources as well. It could be a video, like, for example, the European Commission has developed. It could be an information leaflet. It could be an infographic. All such supportive material might be important when patients go home to let's say, answer other questions that they could have afterwards.
Thank you, Yannick. I just have one question listening to you. We're talking about, you know, the different ways to communicate and the importance of it, but I'm just trying to get a sense, who should be doing this communication? Who should be doing it towards the healthcare professionals? And then are we expecting that the communication to patients happens just in that window between the healthcare professional and their patients? Because we know that there's a lot of information they've got to pass in those meetings, and often a very short amount of time. So do you have any insights for us about who should be doing this different level of communication?
Yes, I think that's an important question. First of all, indeed, it's often it will be the healthcare professional who provides information towards patients. It's always, let's say, a trickle-down effect from healthcare professionals towards patients. I think the ones who should be informing healthcare professionals, we have, of course, a lot of postgraduate educational initiatives that exist already. Often this will be from scientific associations, it could be medical associations. I think they're all at the forefront of providing information towards their professional members, let's say. On the other hand side, the regulatory agencies, in my opinion, should also be supporting such initiatives and also provide the right amount of information from more scientific or regulatory level. And this is a last aspect that I also would like to highlight here is the responsibility of the universities, the academic sides. These are the ones that also should be informing or educating physicians, pharmacists, nurses during their education about biosimilars as well. It should not only be a post-graduation thing, let's say, it should also be one of the topics that should be addressed during curricula at the universities as well.
Thank you very much, Yannick, for answering some of my questions. And we're about to come to the section of our webinar where we're going to be taking in your questions, because I'm going to have a panel of speakers who will be able to pick up on that. So thank you very much to Barbara, to Professor De Moura, to Professor Callo, Dr. Giuliani, and Yannick van der Plas for your great introductions. And I know you're going to join us for the panel. And in a moment, I'm going to introduce a member of the European Parliament, Mrs. Dolors Montserrat, who will give us some insight. But Mrs. Montserrat, just to give you a quick update on where we've been so far, we started with a really powerful message from Barbara from the point of view of patients, of how, particularly for patients with metastatic or very advanced cancer, biosimilars and biologics can be a game changer. They are literally can be the gift of life, and yet they're unevenly applied. It's in many countries, it's unclear who has access to them and on what terms. We heard from Professor Callo just how much countries, lower income countries across Europe, could benefit from this, and it would make such a difference. We heard from Professor De Moura what structural things we need to put in place in our health systems in order for us to use biosimilars more. Dr. Giuliani talked about what the incentives would be in the system to make sure we roll these things out. And there, Yannick just explained for us, how we need to communicate to both healthcare professionals and patients so there's both greater trust in this new thing, biosimilars, what they are, and an understanding of how they could be useful and appropriate in different contexts. So now let me pass the floor to you, Mrs. Montserrat, to give the view from the European Parliament. The floor is yours.
Hello, good morning. Do you see me? Yes, okay, perfect. Yeah. Thank you very much. It is a great pleasure to be with you today, and I would like to thank Digestive Cancers Europe for organizing and inviting me to this very important event. I would also like to express my gratitude to all the speakers that have spoken before me for their insightful and interesting presentations. I'm so sure we can all agree that the topics raised demonstrate the positive impact of biosimilars medicines in increasing access to biological medicines for cancer patients and in contributing to healthcare system sustainability. Last year, the Commission launched very important initiatives, the new Pharmaceutical Strategy for Europe. As you all know, I have been appointed by the MEP Committee as a rapporteur for the European Parliament, and I was pleased to see biosimilar medicines recognized for what they can contribute to the strategy as a whole, and especially to one of its main objectives, ensuring access to biological medicines, which especially for cancer patients may be the only option for their survival. Indeed, the valuable role of biosimilars in cancer treatment, and particularly in colorectal cancer, the second most common and deadly cancer in Europe, is something that should be receiving increased attention in the month to come. I'm committed to driving this conversation and ensuring that the value of biosimilars is considered in the creation and implementation of the pharmaceutical strategy. This is evidence-driven, as biosimilars are of the same quality, safety, and efficiency as the reference products. Additionally, the use of biosimilars medicines can contribute to more sustainable and affordable healthcare systems, which have been under immense pressure long before the COVID-19 pandemic. It is thanks to the everyday activities of various organizations, such as patients' organizations like Digestive Cancers Europe, that European citizens, as well as us, policymakers, learn about the added value of biosimilars and the barriers to their acceptance. I'm impressed by the activities and commitment of DICE to improving education on biosimilars. As a former health minister, I recognize the importance of providing adequate education on biological treatments, not only to the patients, but also to healthcare professionals. In recognition of and response to all the added value brought by biosimilars medicines, I acknowledge the need for and fully endorse the call to action. The call, which will be presented shortly by Digestive Cancers Europe, addresses the need for improving the use of biosimilar medicines in colorectal cancer by adapting European Union policies. Without giving anything away, I call on my colleagues and various stakeholders gathered here today to join me in supporting this initiative. So thank you again for the invitation to this important event, and I look forward to a fruitful discussion. Thank you very much.
Thank you very much, Mrs. Montserrat. And it's so useful to have your perspective, both in your current position as the rapporteur for the new pharmaceutical strategy and your experience of having been a health minister. So you know some of the challenging trade-offs that you have to make and difficult decisions when you've got to allocate resources in a health system which is never short of demand. It's never short of things to spend money on. So the biologics are an opportunity. They're in fact good news, because they give you more capacity to make different choices. So I think this is really valuable to have you, with your past experience in your current role, and we welcome your offer of support and partnership for Digestive Cancers Europe. And as you say, there's a call for action coming. So thank you very much. Let me now come to our panel, and I think we'll start. I'm going to encourage you, the audience, to share your questions that you'd like to ask the panel. We've had several that have already been submitted in our Q&A function, but I'm going to start by, as we began our whole webinar, with the patients, and I'm going to ask Barbara a couple of questions. You've clearly set out, the individual impact on you, at quality of life, your families, but let's now look at how we can broaden that out. Do you believe that savings from biosimilars could be used to improve patients' quality of life?
Thank you, Tamsin. Certainly, when you're patient overnight, as I was, I've been working the day before, your life's completely changed. And you suddenly have to look at everything as new. And you've no experience, and your family's no experience, your carer has no experience. They don't choose to be a carer, they're thrown into it. So there's so many aspects that in this busy life, and with the increasing numbers of people diagnosed, which can be a good thing or a bad thing, but there are increasing numbers in the wards. And you're there, you do not get that individual attention. Some people are lucky, but as general, it doesn't happen. And advice with your diet, specifically for colorectal cancer, it's very important. Your psychological effect of having had to leave my work and told you won't work again. these are the aspects where money could be spent to really help the patient. Specialized colorectal cancer nurses, they understand what it's like for you to suddenly begin a stoma. And that's probably one of the biggest fears colorectal cancer patients have. Deal with it. So there are so many ways in which money savings can be spent to benefit not just the lives, but the recovery of that patient.
Thank you, Barbara. And I'll come back to you in a minute, but let me just bring in Professor De Mora there, because you know, Barbara, you've talked about how savings could be used to really improve other aspects of the quality of life of patients. So, Professor De Mora, what measures, such as, you know, gain sharing agreements, do we need to put in place, particularly in the biosimilar fields? In other words, why, you know, mainly prescribers are in need of additional information in order to prescribe biosimilars?
Thank you, Tamsin. That's a good point. And actually, I understand that you may, or our audience may not understand why do we need to incentivize this, particularly biosimilars. Well, you see, we have in Europe the experience that biosimilars have entered the game at a very slow pace, right? What that means is that had a cost of opportunity for the patient, meaning that not using biosimilars or biosimilars entering slowly into healthcare systems has a cost for the patient, what we call a cost of opportunity. And we know that there are quite a few reasons for that. We've talked about education. Rosa's mentioned it, very interesting. We've talked about the fact that there might be biased messages out there, that the biosimilars represent a change of the paradigm. All those things are sometimes making prescribers reluctant to use them. So we need to counteract that. We need to compensate for that. Governments need to take this into account and actively, very actively, try to counteract and establish agreements to incentivize biosimilars use. At the very least, in the coming years, this needs to be done, because if not, the added value of biosimilars for the patient will be minimized. So I think it is important, and everybody has said very sound things regarding this incentivization.
Thank you, Professor De Mora. Let me come back to you, Barbara, because we've just heard there about the incentives that will be put in place so that healthcare professionals, you know, understand what to do and might use it. But what could governments do to increase education and awareness about biosimilars amongst patients? Because obviously there is an interaction, and, you know, patients can also ask for and bring that issue up, but only if they're aware of it.
Absolutely. So education, as you say, through patient organizations where patients can get trustworthy information and reliable, and they can put patients in touch with one another, patients who've experienced similar illness. And that is so helpful to patients. So first of all, the advertising, the publishing of materials, maybe even on the television, personal contact, people going out and talking to groups of patients in hospital, for instance, and making it known that this is now a viable drug, that it is trustworthy, that it is the same in effect, and there's nothing for them to fear. I mentioned before, we've heard of the first type of biological treatment for colorectal cancer, and I was offered a choice of two. 50-50 chance. We know a lot more now, and when we're talking about biosimilars, I would trust that it is exactly the same as the one that I had.
Thank you, Barbara. Professor De Mora, can I come back to you to say, do we have any good examples of national governments who've managed to boost acceptance of biosimilars?
Sorry, I wasn't. Actually, we do, and maybe Rosa can speak about that, because there are quite a few examples in the UK and Italy. And Rosa is, you know, half half British, half Italian. Anyway, yes, the UK actually was the first country to actually foster gain sharing agreements, I believe, if I'm not mistaken. I remember there's a case that has been published about Southampton General Hospital, where the rheumatology department reached an agreement with the healthcare provider, where each patient prescribed with a certain biosimilar in gastroenterology, for each biosimilar prescribed to patient in gastroenterology, they will receive, I believe, 500 euro, and that fostered and that increased 500 euro for medical department, not for the physician himself or herself, and that fostered clearly two things: the possibility of reinvesting that money into personal hiring technology, whatever, computers, whatever they needed. And there was also an increase in the number of patients treated. So that created two outcomes. And that was the UK, but Italy also has been very active in promoting that kind of thing. I think there's a region called Catania where there was a certain agreement that a part of the savings were reinvested into the hospital, the medical department, and they could use it for innovative drugs, they could use it for personal hiring as well. So yeah, there are some examples. Unfortunately, we need more experience. We need to expand this to other countries, and that's why I said what I said. But it looks that those agreements work and benefit the patient ultimately.
Thank you. Let me bring in Dr. Giuliani at this point. And as Professor De Mora says, you have a foot in both camps. You have experience in both the UK and Italy. So what can you share about your experiences about biosimilar acceptance in both jurisdictions and both environments?
Yeah, so I'm very confused at the moment. This is another way to read it. Okay. No, I'm just joking. I think that while listening again everybody, and now the intervention from Professor De Mora, I think it's clear something that has been already hinted at, which it's a sort of universal message in terms of access, in terms of reinvesting and so on, which is one size does not fit all. Okay, so and what I think is really important is that it is the transparency I alluded to. So it may be in some hospital, in some environment, it may be very, what has been the savings from the introduction of biosimilars may be dedicated to better supporting the patient journey, even though I think that personally, I think that funds should come, should be established coming from other sources, but it can be an option. In other countries, it may be the investment to wider access, where access is a problem. So it really depends, and I think that the common trade union between all these the concepts is to have clarity about what we are doing about reinvesting savings. Then there are different models. There is a model that is I say that is more, if you want, democratic, in the sense try to engage with people, let them understand what's going on. And there are other countries that have adopted, if you want, a less democratic way, and say, okay, this is clear, this concept. From now on, we are going to, have the uptake of biosimilars because science is clear, and actually it's up to the different categories to, to understand what's going on. And, there are criticisms and positive points about, both models. What I can say is that for me, in my experience, it's really key, and this was said by Yannick before, that the communication is extremely important, and a positive communication, a confident communication is actually helping the interaction with patients. Because if I'm not really maybe, well convinced myself of what I'm sharing because the hospital told me to do so, possibly this is an example of non-effective communication, and patients are rightly in the position of nurturing some doubts about what they are receiving. So I think this is a key point, but it doesn't exist, to come back to your question, something that is valid and a way that, that is valid in every country, in every setting. There are different examples, different positions, even within the same countries, in different hospitals, in different trusts that may adopt different strategies.
Can I say something, Tamsin?
Yes, please go ahead.
Yeah, very quickly. I think that in the whole, biosimilar communication, educational sessions, etc. Why not? I mean, industry can play a role as long as it's transparent. I mean, as long as things are displayed and disclosed openly, I'm sure that industry is happy, and I know for a fact that most of them are happy to collaborate into that with governments, with patient associations. And I think that, again, as long as it's a transparent collaboration, as long as things are done over the table, I don't see any reason why not the industry could provide resources for that educational process that is very much needed.
Thank you. Let me just come back to you, Dr. Giuliani, for a second, because at the beginning, Barbara said that she still remembers 13 years later the conversation with the liver specialist who she spoke to, and how he gave her this information that turned out to be life-saving and life-changing. So, Rosa, in your work as a medical oncologist, how do you approach the conversation about switching to a biosimilar with your patients?
So again, there are different modalities of interacting with patients. Barbara said also something very interesting. I do not know if Barbara said a lot of interesting, raised a lot of interesting points. I do not know if it was Barbara or someone else saying that not all patients require the same or do want the same level of information. So I have different scenarios. In some cases, there are patients that just say, listen, I mean, I trust you. I think that you're doing the best you can do for me with all the limitation, of course. Including very likely, Barbara, for you that we were wrong in communicating you the prognosis many years ago. Okay, I'm very happy that we were so wrong. So basically, there are this typology of patient, and there are also patients that question me about why FDA or EMA they have done this and that. So there is a different level of communication and a different level of engagement. Once again, I think the most important thing is to discuss science. So what the patient wants is that wants to have access to valuable drugs that, as I say, can be transformative. And it's not just the drugs. Now we are discussing drugs today, but pathways of care is entire journey that actually is relevant. And they just want to be sure that they are not missing anything. And so the key point is try to convey in a very easy way, in a very transparent way, that actually they are not by receiving this drug, which is from the substantial point of view, the mechanism point of view, and the outcome that we expect exactly the same. Is not possible. There are slight modifications in the process of drugs which are not relevant to the final outcome, which are not relevant with respect to the toxicity. So this is not in discussion. There are really very key concepts, simple concepts. And I think that when we have in the discussion, again, in a very direct and transparent way, those concepts should be highlighted.
Thank you, Dr. Giuliani. And let me now bring in Yannick, because you're the person who's specializing for us in the conversations, the education, and the information, both towards healthcare professionals and patients. So, we've got a couple of questions for you. What's the best examples of national or hospital level incentives to train and educate healthcare professionals and patients? And you can choose either. At the moment, we just want to hear some examples of where we would consider, good practice, where things have worked well.
Yes, I think this is a great question. It's also something that we looked into in the past to find really those examples that were effective in communicating the information towards healthcare professionals on the one hand side or patients on the other hand side. When thinking about patients, for example, I would like to say, first of all, that there are a lot of information out there. There is a lot of initiatives going on in parallel, whether it's coming from the scientific associations, from patient associations, or from governments. We've seen this a lot, not only from the European level, but also from national levels. I think, first of all, the brochure from the European Commission, they have made it for patients as well as for healthcare professionals, has been a great initiative. It was in collaboration with the European Patient Forum as well. I think it was a good initiative. The information is very clearly developed, and a video has also been made publicly available on YouTube, if I'm not mistaken. So it's also, this is a great way to let's say, make digestible information for patients as well as for healthcare professionals. For patients, I'm also thinking about the toolkit that has been made available of the International Association of Patient Organizations. They made a very clear toolkit with different, let's say, layers of information for patients on the regulatory side, on the scientific side, but also just practical information on the product level. So a lot of information is being developed out there. I'm also thinking about the ESMO brochure toolkit that has been developed as well, with a lot of infographics for patients, but also for healthcare professionals. I think this is also a great initiative. When thinking about specific national initiatives, I think one of the initiatives that we found a couple of years ago, that is, I think, one of the, let's say, best examples is the one of Australia, where they developed the biosimilar awareness initiative in 2015 as a central repository for information towards patients as well as for healthcare professionals. They do this as well in parallel. They make a lot of fact sheets for different products, but also general information that is easily understandable for patients. More closely related to this, we've also seen the initiative from the Netherlands, where the IBN, so Initiative Group Biosimilars, they, with the support of the government, make information, trustworthy information, correct information with the right scientific input, especially made available for patients. They do a lot of things. They make symposia, they develop information online, and also do congresses and such kind of, let's say, they make different, they use different channels to provide information towards patients as well as to healthcare professionals. I think those are the, let's say, the main examples that I can think of that really build trust and raise awareness among the patient and healthcare professional community. I think you're still muted, Tamsin.
Sorry, I think we've got a really good example of that happening in our chat right now, because Anthony Rossi has asked the question, is a biosimilar drug product the same as another biological drug product? Are there any differences, any risks, any side effects? These sound to me like exactly the kinds of questions that a patient would ask if they're in front of their healthcare professional who's suggesting to them, possibly they're in shock, they, like Barbara, just been diagnosed, and in comes the doctor and starts using terms like biological biosimilars, and patients really want to know and be reassured is, am I going to get the same quality? Will it have the same effectiveness? Is it as safe? Are there any additional risks? So clearly, Yannick, those are the kinds of things that a healthcare professional would need to reassure the patient. And the healthcare professional would need to feel confident in that, to be getting that kind of information from the regulator. Now, we heard earlier from some of the examples, and I think it was from Dr. Giuliani, who was saying that, some of the ways that we raise confidence amongst healthcare professionals is a community of peers who are actually prescribing. Then when the medical societies and others are putting the information out there, Professor De Mora said, if we've got registries where we've got sufficient patient numbers that we can track and show it. So these sound to me like the kind of infrastructure things that need to be put in place to create the confidence in healthcare providers so that they can give the right answers to their patients. Is that a chicken and egg, that we won't have confidence by healthcare professionals unless regulators and others do something?
Yes, I think that is true. I think it's true that indeed the regulators, let's say, are on the top of the pyramid in providing information from the first hand, since they are the ones who are evaluating biosimilars from a regulatory point of view. So indeed, I think let's say, when building trust, it should always start with the larger regulatory agencies providing correct information and building trust among the scientific community. I think it's a necessary condition if healthcare professionals have trust and really know what they are prescribing and really believe the biosimilars are indeed equal treatment alternatives. Only then they can provide information in the right way and in the right sense and the right amount of information towards their patients. So I think indeed the regulatory agencies should be at the forefront.
Excellent, thank you. And Dr. Giuliani, I think you also wanted to come in on this issue.
Yeah, I think it's, I mean, there is, again, it's a teamwork. Okay, so basically, as a healthcare professional, for me, it's really important to know that science has been adequately produced, so the volume of elements that I need to make my choice. Regulators are on it, but it's not only regulators I derive my confidence from. I derive my confidence from, as I say, from guidelines, for instance, that actually are reviewed by society. I derive my confidence from many association, patient association, the dialogue with, you know, different players. So I think it's really a teamwork. What I struggle to accept, you know, these days is that we are still questioning some points, such as the science behind biosimilar, such as, you know, the question, are they active or not, are they effective or not? Because actually now it's many years from different sources that this concept has been clarified. So we should be now more paying attention to the next level, say, okay, where are reinvesting, how they are warranting the uptake of biosimilar, how is warranting the, you know, the wider access, or, you know, reinvesting on savings, how are we going to play in different models. But I really, as an healthcare professional, I really cannot accept anymore questioning about safety and efficacy of these drugs, because I mean, I do not have any other words to say that they are safe and effective. And I thought that, you know, this phase should be now, you know, passed behind us.
Thank you, Dr. Giuliani. And we've spoken quite a lot about the regulators. So now let me bring in Mrs. Montserrat, who sits in the position of regulators at European level and has been at national level in that similar process. We had a very strong call from Dr. Giuliani, who said, you know, we shouldn't be arguing over the science anymore. It's been a number of years, it's been proven, it's now time to actually put the things in place to incentivize it. Now, looking at the tool we have at the moment is the new Pharmaceutical Strategy, and recognizing that at European level, we can't dictate what member states do and how they do it. But in our approach to pharmaceuticals, how can we put biosimilars in there as clearly being something we can have confidence in, something that's got proven safety and efficacy and should be encouraged as a use?
Thank you very much. Let's see, because now we are in, we think that we are going to vote the strategy, the next plenary on November. So now, you know, we are finishing doing the approach with all the groups to negotiate the strategy. But as a rapporteur, first, perhaps 4 important things that there are in the strategy about the biosimilars. The first thing for us, very important for me as a rapporteur, it's that we have to stress that generic and biosimilar medicines are accessible and affordable treatments and contribute greatly to the budgetary sustainability of healthcare systems. For me as a rapporteur, it was very important to put on the strategy, first, on the center of the strategy, the patients, of course. Second thing, more invest, more research with all the unmet needs. And the third thing, very important, is the sustainability of our health systems in all the 27 member states. Because one big difference between us, Europe, and United States, it's that our health is universal. And we want to keep that. Why? Because we want the equal access for everybody around Europe. So this is one of the main importance or main objectives in this strategy, to have this sustainability of our health systems. So the biosimilars give us this big opportunity. Second thing, very important, I think as a rapporteur that we are calling, or I'm calling to the Commission to introduce measures to support a greater market presence of these medicines and to harmonize at European Union level. This second point is very important too, because we have to push and we have to help you. Third thing, very important too, it's to call on the Commission to design rules for the industry that promote research, development, and the production of generic and biosimilar medicines in the European Union, and to propose European Union protocols for the interchangeability of biosimilars medicines. This point is very, very, very important, and it is on the strategy. And the fourth point that I include on the strategy, it is to stress the importance of improving education. I said at the beginning, improving education on biosimilars. Call on the European Commission to promote relevant educational and communication activities amongst healthcare professionals by setting up a dedicated Europe-wide online resource center. So this is perhaps the four main important points that there are in the strategy. It is true that, you know, we are closing, or we are at the end of this strategy before it's going to be voted in the plenary on November. But, you know, my opinion as a rapporteur, it's perhaps these four important points.
Thank you. And then let me ask you just your experience of guiding this through the European Parliament. Dr. Giuliani said, look, biosimilars have been around for a long time. The science is clear. And yet from our other panelists, they said, actually, but we still need to educate healthcare professionals who we would assume spend their time reading medical journals, but policymakers perhaps don't. So when you were drafting the report on the pharmaceutical strategy, did you, and you started talking about biosimilars, do your other policymakers know about them? Was this a surprise to them? How much do you think we still need to get the message across to people about what they are and how they could be used safely for a more sustainable health system?
Well, I think that the strategy is going to be a big role for that. Why? Because from that strategy, it's going to pen the next directive in the next decade. So if in this strategy, it's saying already that we have to promote this education in all the state members, it's going to be a very important thing. So I think that we at the European Union institutions can promote the dialogue and cooperation among member states to share their best practices, facilitating spaces and opportunities for private-public transparent partnerships, for knowledge sharing and education opportunities for patients, doctors, nurses, and hospital managers. We have to integrate cost savings benefits of biosimilars with the added value of these medicines in the member states' dynamics for allocative resource to national health systems destinated to evolve the use of biosimilars. So, you know, I think that this strategy is going to be a really start point for all European state members. And after that, I think that the state members, they cannot say, I don't know anything about biosimilars. So we have a big opportunity, and I hope so that this month and a half before the plenary of November, we, all the groups, are together and agree on this point of biosimilars. And all this last month that I've been dialogue and negotiate with the rest of the groups, I really see this will of everybody to include the biosimilars as a really good and important medicine and tool for our health public systems in all around Europe.
Thank you. And I'm just going to see if there's an additional layer that we can add to this conversation, which is that as a result of COVID, there's been a new focus at European level on our strategic autonomy in the development of medical supplies and medicines in Europe. And I'm wondering if there's also a way that encouraging the use of biosimilars is another way of fostering innovation and SMEs and our competitive potential, because the more capacity we've got to manufacture high quality, safe medicines in Europe, the more we have resilience in the case of another major challenge. And this is something Mrs. Montserrat perhaps, and also Professor De Mora, I don't know if you want to reflect on that. This is a new focus to say we realize that our life sciences in Europe is a jewel that we need to protect, and whether biosimilars have a role to play in creating a more diverse, innovative ecosystem for pharmaceuticals in Europe. Mrs. Montserrat. And then I'll come to you, Professor De Mora.
Yeah, certainly. This is something that, from what I know, that the European Commission is trying to foster production of high quality medicines within our frontiers, because the COVID has shown that shortages or losing control over what we produce to some extent may create inequities, may create problems within or in our patients. So yes, there's no doubt that biosimilars may contribute to this. And in fact, one of the requests from biosimilars associations is allowing to have biosimilar production within our frontiers, and to that extent, probably contributing to higher savings and therefore contributing to further accrued innovation. Actually, it's been named a few times. Biosimilars do bring innovation into the healthcare system, the marketplace, by many different ways. One is the one you mentioned, but there are other reasons why biosimilars foster innovation. There may be innovation within the biosimilar itself, and that probably is something that should be incentivized to some extent to add some value to the biosimilar product. And there's innovation from biosimilars by fostering the development of new drugs, giving the expected competition that will come later. So yes, absolutely, and this is a request by the biosimilar companies as well.
Thank you. Mrs. Montserrat, is that an additional element that is of relevance, that a thriving biosimilar ecosystem with more companies producing is good for the overall competitiveness of Europe's life sciences sector?
I'm sure, yes. I think I want to add something else on what Fernando said, that now in Europe, we're not going to have just this strategy. It's true that the COVID give us lessons, a lot of lessons that we have to learn all around Europe and all the European institutions. And we start to put the first stone of the future of the European Union for health. So what does it mean? No? Until now, we have the European Union for the money, for the euro, for the financial, for the bankery. But we think that after COVID, we have to put the first stone of the European Union for health. The plan against cancer, the European Union health program, the new European Union for a program, no? especially for health. It's the first time that we have one autonomous program for health, then this strategy, then the era that we already create, and now it's incubation. So I think that this decade is going to be the decade of the research, innovation, and health decade in Europe. And I think so that we are going to have a really good opportunity, experience to help all the SMEs, all the industry all around Europe. Why? Because this European Union for Health doesn't mean that we are going to have more competence and the state members, they are going to lose competence. Means that we are going to be more coordinated, and we're going to have just one European strategy for health. Means that we are going to have one European Union cancer plan, for example, or we are going to have this important strategy that inside it is including all the industry and all the biosimilars industry that they are located here in Europe. So I'm sure that now starts a good decade for our health, a good decade for all the new research, new treatments, and for the industry. So of course, for all the biosimilar sectors. And I think that we have to join and we have to work all together with a big dialogue between all the stakeholders, state members, the European Union institutions, of course, and all the stakeholders, no? As today we are doing. So I'm sure that you are going to be a strong and competitiveness industry located here in Europe, and I'm sure that we are going to give more opportunities to the patients, because at the rest, always I'm saying that the most important thing is to put the patient on the center of our European health policies. And I'm sure that now one of the big objectives in Europe, it's not just the digitalization, it's not just fighting against the climate change, it is to put health on the center of our policies. And, you know, these are big examples, the strategy, the European plan against cancer, the ERA, to put the first stones of this European Union for health.
Great, thank you very much. And I'm going to draw this panel to a close. It's been a really exciting and interesting exchange. So I'd like to say thank you to Barbara, to Yannick, to Rosa, Professor De Moura, and to MEP Montserrat for having answered all of these questions. We did get one question from the audience from Garda asking about how low and middle income countries could deal with things like biosimilars. We think that's a question that's probably best addressed to Professor Callow, and he of course sent a video, so he's not here live, but we will send it to him, and if we can get an answer, we'll make sure it's built into the report, so you'll be able to, we saw it, we recognized it, but we think he's perhaps the best person to answer it. So thank you all to our panelists, and let me now introduce our next speaker, and that's Giulia Berenghi from the Digestive Cancers Europe. And of course, the reason we've had this conversation isn't just to spend some time together, it's because we've got a call for action where we want all of you to be ambassadors and champions to help move to the next level. So Giulia, what's in the call to action?
So thank you very much, Tamsin, for this introduction. And thank you to all the panel and speakers for their insightful presentation and interesting debate. Today, I will present DICE call to action on improving the use of biosimilar medicines in colorectal cancer through the adaptation of EU policies. As the call to action notes, there are important inequalities across member states in relation to patient access to biological treatments. The EU has the power to provide strategic guidance for member states and support the exchange of best practices for policy intervention related to the use of biosimilar medicines, biosimilar-related saving allocation, and to enhance overall education about biosimilars medicines. The call identifies 4 considerations about the current state of affairs in the EU, around which we have structured our ask on the structural changes needed to support the use of biosimilar medicines. So the first consideration is the importance of the multi-stakeholder approach, including patients, physicians, pharmacists, and nurses, in the introduction of and wider and equitable access to biological medicines. Then we ask you to consider the need to increase patients' access to biological treatment and possibly the need to an earlier access. And also to consider that biosimilar medicines contribute to the sustainability of healthcare system by generating cost savings that can be reinvested in healthcare. The last consideration should be that the adaptation of biosimilar medicines into clinical practice depends on biosimilar acceptance by healthcare professionals and patients. In this light, we call on the European Commission to support transparent and tangible benefit sharing practices around Europe. We ask the Commission to support the tangible and transparent application of biosimilar-related saving projects, to allow any savings arising from biosimilar prescriptions to be reinvested in the national healthcare systems. Considerable cost savings may contribute to improve patients' quality of life and care, while widening patient access to biological treatment. We further call on the European Commission to build a dedicated Europe-wide online resource center to support the exchange of best practices on biosimilar saving reinvestment. In collaboration with the member states, the Commission should identify countries and hospitals where biosimilar savings are best reallocated to address patients' needs. We asked the European Commission to set up a dedicated Europe-wide online resource center for healthcare professionals and patients, as the adoption of biosimilar into clinical practice largely depends on the biosimilar acceptance by healthcare professionals and patients. Since the full understanding of the value of biosimilars is crucial to gain trust in this type of medicines, healthcare professionals and patients need to be offered continuous education, for example, through an online resource center. When developing the center, the Commission should use material already developed by EU institutions and organizations such as patients' organization, medical societies, and those prepared by the European Commission, European Medicines Agency for patients and healthcare professionals. The call to action asks member states to adjust national policy to ensure that biosimilar related savings are reinvested locally in a tangible and transparent way. Savings can be invested in many ways to improve hospital services and patients' care, hiring additional hospital staff, for example, enhancing healthcare professional education about the treatment, organizing patient support programs, investing in new treatment, or updating hospital equipment to administer the treatment. The call asks member states to introduce incentives to encourage hospital and healthcare professionals to consider biosimilars in all purchasing processes, invest in educational and communication activities for healthcare professionals, and support patients' organization initiative, and also to invest in the creation of national patients' databases. Patients have a right to receive clear information, should they wish, about biosimilars and how they help their treatment. We therefore call on all stakeholders to support patients' organization in raising overall awareness about biosimilars, and to actively call on the member states to organize communication campaigns to reinforce patients' knowledge, acceptance, and trust in biosimilars medicines. This call to action will be shared by DICE on our website and through social media, and we encourage policymakers to endorse this statement and bring the change that patients need. The call will be open to endorsement and support until the end of October, and will be shared with the health community in occasion of the Biosimilars Week in November. We sincerely hope that organizations in other disease areas will follow up on this action, and we will continue to work at national level with the strong community of our member association. Thank you.
Thank you very much, Julia. And you're going to see in the chat, we've put the link to the call to action. Please feel free to spread it widely, because as Julia's mentioned, we'd like to invite as many individuals and organizations to come on board over the next 6 weeks to create some momentum to take this forward. And let me just sum up what we discussed this morning. We began with a very powerful story from Barbara about her experience as a patient, and how a biosimilar had a life-changing and life-saving effect on her, and that she's now used that as a leverage for campaigning to make sure more people and more patients have access to this, and that this becomes more of an opportunity rather than an exceptional campaign that individuals have to fight for. So we started from that, and then we explored some of the challenges in the system. We understood that there are gaps and barriers, and these may be educational. Healthcare professionals may not be aware about the latest range of biosimilars that have been approved and that are accessible. They may be financial, and we need to look at the incentives in the system and understanding clearly and transparently so that healthcare professionals understand and start the conversation with their patients about the use of biosimilars. They need to understand that there's a real benefit, that it would allow them to treat more patients, or it could provide additional add-on value around quality of life, additional nurses or other support that could be offered to patients. So there is a real return on the investment for them about learning about the biosimilars and engaging with that in their everyday practice. We talked about the need for there to be, for healthcare professionals, a greater guidance. There needs to be community of practice. They need to feel confident that their peers are also doing it. We need to make clear, as Dr. Giuliani said, the science is clear. There's no question about that anymore. The safety is clear. They've been used for some time. Healthcare professionals and patients should be able to confidently continue on their journey to use biosimilars. But we need to make that information clear, because so that people don't feel that they were getting somehow second class or lower value in order for some bureaucratic cost saving measure. We need to be clear this is a strong and clear health benefit, as well as individual and collective gains. We talked also about, bureaucratic hurdles, and this can add an additional layer of complexity and they need to be removed. Barbara shared, all the things she had to do in order for her clinician to be able to offer her this solution. And this shouldn't be the hoops that people jump through. These should be an additional range of things to give both clinicians and their patients more options and more choice in the way they do for this. We explored the multiple wins this could have in terms of cost for healthcare systems, where budgets are under pressure, a greater range of options and choices available. And we also had some very compelling data provided by Professor Callo at the range of existing differences across Europe in terms of outcomes for patients with cancer, and that this is really quite unacceptable. When we have the science, when we have the medicines available and the evidence is clear, there's no reason that we shouldn't across Europe be able to offer our patients similar quality of life and similar opportunity. We heard from the European Commission, the European Parliament, how there's a vote on the Pharmaceutical Strategy coming up in the next few weeks in plenary, and the rapporteur, Mrs. Montserrat, has already covered biosimilars within the strategy, made sure it's very clear, both the benefits to the system and called upon the European Commission to undertake education campaigns to make it clear just how valuable it is, the safety and the utility of it. So we've had a whole conversation about what needs to happen, and Yannick gave us really good insight into how the communication needs to happen, the education to make sure everyone has appropriate information. You need general information for new cohorts of healthcare practitioners and professionals and integrating their continuous professional education. And then we need tailored information that's relevant to the patient in their individual circumstances and in the context they're in. So a range of different types of information that's needed. And then we've just ended up on a call for action from Digestive Cancers Europe, where they encourage each of us to be active players in changing this situation. Because I think I'd like to end this by saying, biosimilars are a good news story. They offer incredible benefits and potential, and sometimes even a lifeline for patients. And there's no reason why we wouldn't want this to be more widely available. It's safe, it provides cost savings, it provides more options for treatment, but we do need to track it. We need the information to generate our new knowledge, and who knows, the more use that we have, the more access that patients have to this, the more data we collect, the more opportunity we might have to see who else might benefit, how else we could deliver opportunities for improvement, both for individuals and for health systems. So I think there is no reason to be going backwards, but there's clear opportunities to move forward. But this needs change in practice by regulators, by the leadership in the medical community, and at the patient-clinician interaction. So we call on all of you to be part of this call for action. The link is in the chat. Thank you all for participating this morning and being part of this conversation. I hope you've learned things. I hope you've been inspired and feel empowered. We started with such a powerful story for Barbara, and I think I'd like to leave you with that message to see that we can make a difference. One person's story can be transformative. Barbara campaigned, and now she has managed to get a change in the rules for every patient in the UK. This is the power of patient advocacy, the power of stories to make the case. And we can each from today take some of the arguments and the stories to make the change in the environments we work in. So thank you all for participating. And I hope to see you again at another event by Digestive Cancers Europe. Feel free to visit their website to find out more and sign up for the call for action. Thank you and goodbye from Brussels.